Hello everyone and welcome to our podcast. One piece of advice.
The amount of joy that they will give, the same amount of sadness also they can give you.
So why are the first 30 days considered as the most important days?
Sorry to say. Dog which was taken for treatment and she never came back alive. Insurance is a very good way.
Habit that every pet parent should avoid.
Small area. It can reduce the lifespan by 2 years. Either it may be a treat or it may be saying, oh chalo, aap ghar aa gaye, let us घूमने जाएंगे.
Hello everyone and welcome to our podcast. I'm your host Sahira and today we are talking about that's very close to the heart of every pet lover. Welcome home, the first 30 days with a new pet. Bringing a new pet home is a joyful experience, but also it comes with a lot of questions and responsibility. The first month plays a crucial role to helping your pet adjust. Stay healthy and build a strong bond with your family. To help us understand everything new pet parents needs to know, we have a very special guest with us today, Dr. Lakshmi Srinivasan, a surgical specialist with over 33 plus years of experience in animal healthcare. Yeah, doctor, thank you so much for taking your time and joining with us today. It's a truly honor that you are with us. So, doctor, can you explain about your whole journey with veterinary?
Yeah. So, I have always wanted to be a vet, and since class 4.
Okay.
So, in fact, they used to tease my classmates also. My other classmates used to say, "Tumhara patient hai."
Okay.
So, since it's an animal, that sort of a thing. So, I have that was my aim, and I don't know why that happened. I think it was because I'm an only child. I had a dog which was taken for treatment, and she never came back alive.
Okay.
So that really affected me a lot. I think I wanted to, I feel that, if not us, who will make the change? So I think that's what fueled me, saying that I wanted to be a vet and I want to do better for the animals. And so that was it. I joined veterinary science. I was the only person in class who, wanted to be a vet by choice, because those days everyone took veterinary science as, when they did not get a medicine seat. Yes. Or didn't get a dental seat. I think it's similar. But it's changed now because the profession has changed a lot. Because those days it was not a white collar profession. Yeah. In fact, my entire family was against me for that. So still, my mother and I, we fought it and became that. So I became a vet in 1991. Okay. I finished my BSc in 91. Okay. We started the clinic also then. Okay. So it's been now 36 years or so. August 15th is when we'll be celebrating our anniversary.
Okay, that's
so
great.
I think 36 years is what we're doing now.
Oh, great. So why are the first 30 days considered as the most important days for the new pet?
Yeah. So see, change is happening, and change is not easy for anybody.
Yeah.
And usually what happens, people take in puppies. Okay. Yes, it depends upon whether they're puppies or adults or adopted. Anything, it's a change. So there's a change in environment, change in food, change in the people who are around you, change in the caring. And sudden changes, body is not able to adapt. Yeah. And usually there will be immunity issues at that time. So it is like, for us, suppose we suddenly travel to Russia. Okay. It's a condition change, right? Temperature change, everything change.
Yes, yes.
And normally, why do we fall sick when we travel? Because we are not used to that. So it is similar to travel stress. Okay. The body comes under stress, it's under anxiety, and then they are very prone to, it's an open gap for the diseases to come in. Okay. So we have to be very careful in the first 30 days. It's also the time when you are building a routine, a pattern, a relationship. Okay. So it's not only a disease issue, it's a psychological and a relationship issue also. Okay. So those are the important days for you, for you to make the foundation right. Yeah.
So we need to plan a routine for
your pet. You have to plan your routine also along with it, because a pet is a family member which is coming.
Yeah.
Right. So you have to understand the pet. It's a time when you're understanding each other, and you're building a routine around it.
Okay.
Yeah.
So what emotional and behavior changes do pets typically experience when they move to a new home?
Yeah. So see, we should understand the journey of a pet also, puppy. See, what's happened is Nowadays, there are no breeders in the city. Earlier, there used to be breeders in the city. Outside used to go, these commando kennels used to be there, Chandrasekhar used to be there. So many people, Sharma, all of these people used to be breeders who used to breed in the city only.
Okay.
So generally what you would be doing, you would go to the breeding in the kennel and you would go and select a puppy and come back. Those days there were no pet shops as such.
Yes, yes.
So directly the puppy used to come from the kennel to your home.
Yeah.
Even then there used to be issues, but less issues than now.
Okay.
Now what is happening, puppies are being bred out of the city, somewhere where it is cheaper to breed, labor is easy, food is easy, and it's expensive in the city. And these puppies are sold in lots. They go and then one lot is sold, so many pet shops buy them.
Okay.
So they buy them and bring them. And they keep them in the pet shop like a display.
Yes, yes.
Right? And then you go and see the puppy, you like it, you bring it home.
Yeah.
Oh, many times what happens, the puppy therefore has made 2 journeys already.
Yeah.
One person in a pet shop, change, home
Another
change.
person at home change.
Home change.
Yeah.
So it's possible, see, it all depends upon each one's personality, right?
Yes.
You may have a very outgoing personality, you may have a ferocious, aggressive personality, you may have a timid personality. So these personalities, it depends how the puppy adapts.
Okay.
Sometimes they are very timid, they are very scared, they don't want to make friends in the house. They may attach to only one person and as a security issue. They feel that insecurity issues happen. They'll feel attached to only one person. Other people they will not like. And otherwise, you may have this outgoing puppy who likes everybody, running around everything, right?
Yes, yes.
So these are issues that that's why I'm saying you should gauge. It's a thing of understanding, and they are going through a lot of emotional change at that point of time.
Okay.
And we tend to sometimes over pamper them also.
Yeah.
See, the thing is, it is important. As I say, spare the rod and spoil the child. So many times it is the opposite. People are not strict enough in the first couple of days to establish ground rules which they will regret later on in life. So I keep telling people, it's not like it's how we parent. Parenting doesn't mean always like, see, grandparenting is different. Grandparents, they will do, they'll spoil the children. Right? Because they enjoy doing that.
Yes.
It's their right. But parents, what we do, usually mothers will be the bad ones. That is good cop, bad cop relation, right?
Yeah.
We'll be strict, we'll be scolding, this is right, this is wrong, this is correct.
Yeah.
So those ground rules should be established. So when I tell, see, what is right now, what is wrong right now, is wrong always throughout his life. He suddenly, after it grows up, you cannot say, okay, this is wrong.
Yes.
For example, puppy is in your bedroom.
Yeah.
Okay, he is sleeping in the bedroom and everything. Suddenly, your puppy is grown up. You are saying, okay, I do not want this dog in my bedroom. To take, for what reason? He will not understand.
Yes, yes, yes.
But you may say the puppy is too big. It's a Great Dane. I mean, I know my friends who have had Great Danes and they're sleeping on the bed with them. There are no issues. But you see, it's a practical issue. Depends on what you want, right? So you must establish, this is your place. This is it's okay for you to be here. This is your place. If it's your bedroom, it's your bedroom. It's your bed, it's your bed. It cannot change later for reasons that you have changed your mind, right? Because it's confused.
Yeah.
You cannot confuse it. This is right and wrong. Okay, you say, okay, you are peeing here. Okay, so it's cold. It is not a place for you to pee. Go outside and pee. We'll take it. It's a matter of training.
Oh, yeah.
Okay, today you are biting and chewing me. Well, later when you become bigger, biting and chewing becomes bad. So how can it become bad? He does not know. He's doing the same action,
yes,
right?
Yes, true.
So these are important. So you need to establish those ground rules in the beginning. So many people spoil them, saying that somewhere they are feeling guilty, feeling sorry for the pet, definitely.
Yes.
Also feeling guilty that they're somehow should not scold, should not do anything. It's a child. It's such a baby, so small little thing, so cute. Such a baby, we cannot be spoiling it. We cannot be being strict about it. And also some people are also unsure of what they can do and how they should do it. So therefore they will not do anything. They will not know how to scold. And some people don't know how to train them also. They will slap them, beat them, do things which is reverse reaction takes place.
They might attack.
Attack also. So these are the things that people say, then finally they don't want to do it, or then a wrong relationship starts off there.
Okay.
So psychologically, you both are wrong.
Yeah.
They are puppies as though as you are. Okay. So that is the time where you have to start understanding and setting the strict ground rules, which is not a punishment. When we send children to school, it's not we're punishing them, right?
Yeah.
But children feel it's a punishment. But every time you send them, then the reward starts coming after. So you have to have a positive reinforcement there. Strict, quiet, calm, always reinforcing. And the same thing should be told in your family also. One family member cannot be spoiling, one family member cannot be strict. Everyone should have the same rules because it's, this is a confusion will set in. So that is an important conversation that you should have with the family. To keep mental health very important because for us also the biggest organ is the brain, and for them also they go to mental health issues also. So to keep no confusion, you have to have ground rules very straight.
Okay.
Yeah. Basically, see what happens according to the AWBI rules. The puppies should be, that is Animal Welfare Board of India. Okay, puppies should be a minimum of 8 weeks. Okay, when you adopt them. So the thing is, but never will you get puppies of 8 weeks because there's a whole story behind it. People want to get free quickly the money turnover.
Yeah.
Okay, and between 6 weeks and 8 weeks, disease progression is higher. They can get parvo and other things.
Okay.
People, dogs can get suddenly parvo. Puppies, that is a parvo virus is a very dangerous disease.
Okay.
And that you have to, be careful about.
Okay.
So
What
sudden
is this virus about?
the gastroenteritis. Puppies can die with it.
Okay.
Yeah, and that is the time that they can get it 6 weeks of age, between 4 and 6 weeks of age. And so the breeders, they have to actually vaccinate it. They have to provide the nutrition. The mother also will, like how we give the mother will have to show certain health behavior things. Mother will take care of the behavior part of things, train them. So these psychological and health issues come up if you don't pick them up after 8 weeks. But people want these cute little puppies. Breeders want to sell them before the problem happens. So they'll sell them fast. And also what happens, another problem is people have their birthday coming. Instead they're going and buying a gift. You can't just say, okay, well, it's someone's birthday coming, I'm going to give a ready-made gift. It's not like a chocolate bar that gets done every day. It's a grown-up puppy, right?
Yes, yes.
So even if it is 2 or 3 weeks old, they'll pick it up, saying birthday ke liye chahiye.
Birthday
Gift. And so I tell people, don't do that. There is a rule, but none of the pet shop rules have to be followed. And it's only important for the pet parent, because then you have a puppy which is vaccinated to a certain extent and healthy to a certain extent, and then you are picking up this puppy. Yeah. But people don't follow it. So we also see puppies 4 weeks, 5 weeks, 3 weeks, we see this. And then we, guide them very slowly how to, the pet parents, so that the sudden change doesn't happen, immunity happens, diet is okay, because the gut is most important for anybody like you. Yes. Any sudden change as a diet, water, anything, it will start off with diarrhea, we start off with the deadly parvovirus.
Okay. So, doctor, I have a question. For this, when we are adopting a puppy from a pet shop, so there are certain rules like you have to adopt after 6 to 8 weeks, or else you can buy and write it now, like anything? That is actually pet shop rules are there, that is enforced by the AWBI. It is enforcing of rules is a different thing. Everything is given by demand. Yes. Right? So the thing is, it is given by demand. It's enforcing of rule as a rule. It has got so many other things to rule to enforce. But the buyer is the king. If we start demanding that this puppy should come in with vaccination, with a valid vaccination by a veterinarian, signed veterinarian, okay, deworming, all of those things done, with a food chart, everything. I want this. Also possible insurance. Okay. All of these, if they come in, then there's a safeguard on both sides. Okay. That that pet shop can demand extra money for that. Which the client will be willing to spend. See, nowadays people are not shy to spend. Yes. If they're getting quality, if they're getting assurance, they will give the money. Yeah. But they should demand. It's from a client situation. So you should demand that these puppies are at least 8 weeks of age, vaccinated, and everything else. Okay. And at least try to know the parentage. Where did it come from? Yes, yes. Where the parents are there? Are you able to see the parents? Are the photographs of the parents? Some validity should be there, no? Yeah. So it always comes from the demand. What the person is asking for. Okay. Yeah. Yeah. So, doctor, one more question. So, how to find a good puppy? Correct. So, the thing is, that is a very tricky situation because you don't even know the parents. As I said, this is the situation now. Yeah. And one thing, as I already told you, when
when you are demanding from a pet shop seller these certain things and they are able to comply to that, many of the things are met with. But otherwise, you should make sure that, of course, when you look at a puppy, it's. I'm talking about both physical health and psychological health, mental health. The puppies were over enthusiastic, sometimes can become aggressive. The puppies were too quiet, maybe sometimes who are meek and
More
they can
aggressive.
be, they can be very introvert puppies.
Yeah, introvert.
Puppies who sit and quietly sit and then look at you and then come and talk to you. They may be the ones who are middle ground who may be good for you in terms of psychological things. Maybe more stable in psychology. The other thing is health. You're looking at bright eyes, you're looking at pink tongues, no diarrhea. See what the poop was like, ticks and fleas on the pet. Okay? And definitely that time you tell that breeder or owner that I would like to take this to my vet to give it checkup before it's called a pre-purchase exam.
Pre-purchase exam.
Yeah, in a pre-purchase exam, we check it out. We see actually whether how old the puppy is.
Yeah.
Whether that person is telling the truth. Because there may be papers saying that it may be 6 weeks, 8 weeks.
Yeah.
When whatever information the breeder is giving to the certifying agent, that only they will write.
Yes.
So if the breeder says this puppy was born on particular date, they will write that thing. Actually, puppy may be 6 weeks only, but they may say 8-week old. So, but when they bring it to us, we see the teeth. We say, actually, is it 8 weeks or not? Or is it anyway weak? Is it, we give that. So, we give a health checkup. We also do what is called the parvo antibody titer test. Parvo is a very disease, yeah. So, if the parents are vaccinated or not, how do you know?
Yes.
Puppies would have developed antibodies. That means they would have developed immunity. We do a parvo immunity test. A test and see whether immunity is good enough or not. Otherwise, how do you know? You just cannot trust that, right? So we do that and we check a deworming and we check the fleas and ticks are there or not. And we do a complete health checkup and say, yes, is this puppy healthy? Genetic diseases are difficult to find out. Okay, you may have certain congenital genetic diseases that may be shown beginning only. But they are very rare. In the sense, those puppies are never brought by the pet shop to sell.
Yes.
Naturally, see what blind puppies or with cleft palate puppies or weak puppies, they are not picked anyway to sell.
Yes.
So nowadays we are not seeing so much, but as they grow older, that will be difficult to tell.
What is the reason behind that? They are coming from their breed itself, from their...
Yes, genetically they think so. They say the purer the breed, the more genetic issues you will get.
Okay.
I always tell people that our best breed is what nature selects. Okay, I call them designer breeds, designer dogs, which are on the street. No two dogs will be the same.
Yes.
If you want designer shirt, my shirt should not look like yours. That is designer. Same way, these are designer dogs. You pick up the one that is designed by nature. No two dogs will be the same.
Yes.
You got a unique puppy pet, okay, and they have the best of health, and the genetic diseases are least. And moreover, what you have done is you have done a great thing for the society. You have given already a born dog a home, right? So that is something that you have done. You have given, an anatha a home.
Yes.
That is something that is very sacred, I would say.
Yeah.
So just look outside the street. I'm sure there may be puppies there, or in front street there may be some puppies. Pick up, and there you will be able to see the mother.
Yeah.
You will be able to see the parents, and you can pick up the puppy who comes in that way. You don't have to choose from what that breeder has already chosen for you. Pet shop. So I always say, pick up those. But genetic diseases are in every animal. That's all part of life. We all get it when it's some age or the other.
Yes.
There are actually tests which are there, genetic screen tests are there. Those are complicated. And as and when they are older, we do master health checkups to screen them and to take care of that part.
Okay.
So that also we can avoid with that.
So what are the most major mistakes pet parents will do in this during month, like first 30 days?
First 30 days, what they do, maximum mistake that they do. And that's important thing is that first they'll before they go to the pet shop, buy the puppy, they have gone and bought a whole lot of treats and everything, welcoming the puppy home. Treats and bedding and shampoos and everything they'll buy.
Yes.
And to welcome this puppy home.
Yeah.
And so that is the biggest mistake, because what happens, the puppy's gut, see, I told you the puppy is in distress, right?
Yes.
So it will not have the ability to eat these new things, okay? First 3 days I tell these people when they come in, You know, first thing you do is when the puppy comes home, give it a nice warm bed, which is, you know, you have got control over. Give it a place for it to relieve its jobs, pee and other things. But always find out from the pet parent what did they fed the dog. Take the same food, even if it is, they may say I am feeding XYZ fancy 200 rupees a kg food. Actually, they may be feeding some chicken and rice.
Yeah.
So tell them to be honest with you. Tell the pet, wherever you buy, whatever you're feeding, please give me the same food. Even if it's kanji, you give me the same food.
Okay.
I won't judge you with that. I don't want that suddenly my pet's digestive system goes for a toss.
Yeah.
It's like, you know, you're having you're eating only curd rice one day. Suddenly you go and eat biryani. What will happen to you?
Yeah.
You will have a problem, and this
Problem
little
with
puppy
digestion.
cannot even digest it, right? So then once the gut microflora, everything now, you know, is a gut, and we as veterinarians, we always come from the diet. For us, diet is the most important thing. That's
Yes,
our
yes.
main thing. And if the gut microbiome changes, then they get prone to parvovirus, everything is. So for the first 3 days, make no change. Don't overfeed. Don't give any treats at all. Okay, give the same thing. Even if you feel sad giving, I'm giving only this kanji for the pet. Be happy you're giving that so that the no digestive upsets are there. And give water, you know, pure water. You know that everyone now has got a filtered water. You can give that water. Don't make any changes there. Don't give toys and chews and stuff like that that you eat and cause
Yes,
problems.
yes.
They give toys and stuff.
Yeah.
Puppy does not know what to do with
Yeah,
it.
yeah.
And also, you find out what, don't start giving all kinds of vitamins and minerals and all that. I said, don't even take it to the veterinarian for the first 3 days. When people call up and say, ma'am, I've got this puppy home, I would like to bring it home. If it's a pre-purchase exam, it's a different thing. I come, I examine it, I do all of those things in a different way. But for bringing to the clinic after you bought it, immediately you bring it there. And to do, you know, for us to do something, I will do nothing.
Yes,
Because
yes.
we are exposing them to the environment,
Yeah.
right? I said, stay at home. Don't let it settle down. Watch out stool. How is it passing motion? You know, is it passing gut hard and it's passing in a formed way? That's how you know it is fine. Okay. So make sure there are no sudden changes.
Okay.
Once these things are established, then you come. Then I will give you the vitamins, minerals, food, and slow changes how you have to make sure that is there. So first mistake they do is they become, you know, the children may give toffee, chocolate, whatnot they give.
Yes.
So you don't buy anything. After the puppy comes, and many times they bought all the things that are wrong for them. So everything, there's a whole bunch of stuff that they have bought and gotten wasted. So come take our advice, because there are so many products that are there that are not scientifically designed. In fact, simple collar, all of those things we should, you know, take an advice of a veterinarian. Brush, even the hairbrush, you know, what you can do to clean the eyes.
Yes,
You know,
yes.
all of those people just buy. And they're so-called pet friendly. What is this pet friendly? No one knows.
Yes.
Okay?
So this is only with the dogs, or else this is
With all cats, anyone, for that
Okay.
matter, any pet that comes in, they should give you the food that they were feeding and follow the same routine.
Okay. So what kind of food they can feed to the first 30 days of pet?
See, it depends on the age of the puppy and also the breed of the puppy. And as I said, what is the type of food that they were giving before?
Yeah.
Generally, see, I recommend, it's not because of any commercial reasons, and let me tell you that. Dog food is really the best, because what happens, what is scientifically made. See, for us, for veterinarians and for animal feed, you know, now we are cat and dog veterinarians.
Yes.
But we are veterinarians for farmers, veterinarians for poultry, veterinarians for cows and horses. And these are all food animals. And that is the nutrition that goes in. And so AFCO and this NRC recommendation, that is food recommendations, like how FSSI has come now, this was there 40, 50 years ago for dogs and cats and animals.
No.
Because that nutrition has to go in for the animal, which will eat it, and then that of course becomes food for others.
Yes.
But the same NRC and ARC guidelines are there for cats and dogs also. And these pet food companies have to follow those. So they guarantee you an analysis. If you eat this amount of food, this is the amount of protein that the dog will digest. This is the amount of fat, protein, vitamin, minerals, everything that is there. Guaranteed analysis is there. And they even test the poop. How much is it absorbed? How much is it coming out? It's a scientific thing. And there are nutritionists that are sitting who are doing this. Now, actually, what there are so-called nutritionists there who actually don't have a degree. They have done some online degree. They are not actually pet nutritionists. Sorry to say. Nutrition is a degree for veterinarians who eat study.
Yes.
As you know,
That's
and
true.
it is these people. So these are, I tell them, these are stage food. For us, where there's a food available, we go to a dietitian, they'll tell them. They know, and they open a packet and say, this is the amount of protein, vitamin I'm getting right now. I eat this biscuit, I can lose this much calorie. It's not like that. So that is a really good food to give, and it is consistent,
Yes.
right? So I would say then depending on the dog breed, I will tell what type of food to give, and slowly change over, and that's what we do. So I totally recommend giving commercial food because it takes one headache off. And not only that, it's a basis. See, health is what I always tell. There are 5 pillars to health. First is nutrition, okay, psychological health. Then preventative health, preventative medicine.
Yeah.
Then physical exercise, okay, and your hygiene, grooming. These are 5 pillars. If you keep these proper,
Yeah.
the chances of you falling sick is less. So nutrition is a huge subject, and it is I would say, the basis of the whole thing.
So, doctor, most of the I used to have a pet in my cousin's home. So my cousin's mom, who she loved dogs a lot. So she told me that first few days when we are adopting a puppy, we can't feed pedigree, the food of that dog. So can we feed that pedigree to the baby, or else how after growing up we need to
Yeah.
feed?
So exactly what I said. So depends on what age and puppy. So there are different. They have got starter feeds, and they've got you've got even weaning feeds. Weaning feeds are there. Starter feeds are there. So when the puppy comes in, we make a slow changeover. We assess. You go to veterinarian after 3 days. We'll tell what food to give, depending on what age it is and what breed it is, or how big the dog will grow.
Yeah.
If it's an indie breed, there may be 22 kgs. We know the adult body weight, what it will grow to. And we also know the genetic other issues, developmental issues that they can have. So we will recommend that type of, and some of them they're allergic to certain proteins. So we will recommend the type of food which is there, and there are different foods for different life stages.
Yes, yes.
And you have to make a slow changeover. Today, as I told you, the dog which is coming with eating kanji, tomorrow I won't say, okay, to feed pet food. No. So it's a slow changeover. Every 2 days, we have to make the changeover.
Okay.
Mix it in, and all the 4 meals should be similar. People say, okay, I give pet food in the morning, I give chicken and rice in the afternoon. I feed.
Yes.
So don't do that, because your gut is not ready for it. See, dogs are living 7 to 10 times faster than we are. For them, their age finishes at 15 years of age. We live up to tortoises, we're like 100 years.
Yeah.
Right? So we are slow compared to them. So their metabolism is like that. If you keep changing the diet every time, then their gut becomes, shocked every time.
Yeah.
So consistency is the key. And when we do a changeover, we say mix it together. So 25%, of the old food, new food, mixed it to 2 days, then half and half, then 3/4, 1/4, and then total food on the 7th day. Slowly the gut will change, and at the time we also keep checking the stool quality. Is it soft? Is it loose? Is it becoming worse or not? If that is there, let us know. Okay, it's possible that even this food that we have told them may not be suiting that person, that the puppy. So because he may be allergic to some of the ingredients that are there.
Yes.
And so we will change accordingly to that.
So how we will get to know that a puppy is affected for this allergy or some infection and
Yeah, so see, that's what I'm saying. You check the poop.
oops, okay.
Is it loose? Is it, so how, if you're having,
upon the poop.
based upon the poop, we also know if it doesn't agree, what will happen? Yeah, body will throw it out. That's the way body reacts. So you check the poop and let us know if it has vomiting. Usually, it won't result in vomiting, but poop is the main thing.
Okay. So the first 30 days, if you are adopting a pet, so which food is the best, compared to home food, or we need to feed them outside?
Yeah. So
Pet
I
food.
told you what pet food is the thing to go. Always just not 30 days. I would say 30 for the 15 years. Also, pet food is better.
Okay.
Okay. It depends on it depends on the pet also later. So usually I will, because nutrition is important, and you cannot provide the same guaranteed nutrition with home food like you do for pet. Why we say we argue when we are happy with it? Why is it a pet not happy with it? Okay, they'll be happy, no doubt about it. And I've seen so many dogs. My grandfather's parents' dogs
Yes,
also.
yes,
They'll be only on curd rice. They've done fine,
Yeah.
right?
Even my pet used to have curd rice
And they'll be
chicken.
fine.
Fine, they will fine with us.
Absolutely fine. But many times, see what has happened is things have changed over the years. Those days, and also we would never see dogs living 15 years those days. If they live 7 or 8 years, we would think, oh, it's fine.
Yeah.
So then is then when the nutrition matters. So we would say it's fine, 7, 8 years, 9 years, 10 years, they would die. Very rarely we would hear that this dog lived for 10 years, 12 years. Okay. So that means actually that nutrition was not okay. The second thing is even our grandparents,
Yeah.
they used to live 100 years. Are
100
we
years.
living?
No.
So there's a change.
Yes.
And we have to move according to the change. So necessity is that you give good nutrition at the foundation in the beginning.
Yeah.
And we cannot say that, cannot guarantee that this is the amount of nutrition that our home food will give. Right? Sometimes, see, when we are young, so our very important time, say, nutrition, when we are growing from babies to, until you grow, 17, 18 in human years. After that, 18 to 30 years, you eat any junk, your body is okay. 30 years after that, any small change, it can't. Similarly, even for dogs. First year, from 0 day to about 12 months to 14 months. Very important growth phase. After 12 months to 5 years, any junk it will take, no problem. 5, 6 years afterwards, it starts showing differences. It will start telling. So it's important right now that you keep nutrition, and so when someone has done the math and homework and made the trouble to give you so many vitamins, minerals, calories, everything they've calculated and say, you eat this, you'll get that. Why do you want to, you should take it and say, reduce the amount of burden that you're having so that you're not sitting. People make elaborate meals, cooking, so many things, and it's a love, and I say that's fine, provided you're able to guarantee that amount of nutrition for them.
Okay.
Yeah.
So, why this deworming is important?
So it's a preventative. See, there's preventative medicine. We talked about nutrition. Now we are talking about preventative medicine. Okay? Prevention of disease. It's important. It's not waiting for disease to happen and then you treat it. In fact, I feel in my clinic I am a successful veterinarian if I am treating less diseases and doing more wellness. Right? Dogs who are going for general examinations because I've been successful in preventing disease. Right? So disease prevention happens in this way. You will have to give, so worms are there in the body. Everyone has parasites. You have got what is called an ectoparasite and endoparasite. Right? Ecto is outside, like ticks, fleas, and other things, which are also important in prevention. It's a huge topic now with tick fevers and stuff like that. And endoparasites are worms. They are sitting inside your body and they come in from the motherhood itself. From the mother into the home, also you can get worms. From the milk also they can get worms into the puppies. And the puppies form full of worm burden most of the time. And that one is sucking up the nutrition. So when that happens, that puppy will never be able to develop good immunity and good nutrition because the worm is taking up all the nutrition.
Yes.
Right? So we need to deworm to get rid of these worms. And these worms are in different life stages depending on what type of worm it is. Roundworm, hookworm, if it's a pinworm or if it's a tapeworm. These are all the type of worms that are there, commonly in dogs. And these have all got life stages. Okay, they have some of them. The one life stage will be the liver, one life stage in the lung, one life stage will be the stomach, one stage will be in the intestine. So these are the life stages, and the dewormer will not affect all the life stages. Not all dewormers affect all worms, and not all dewormers affect all life stages. So what we do is when they're puppies, when there are plenty of worms are there, we split the dewormer depending. We do a stool examination, check to see what worms there are, and according to the worm eggs, we will give a dewormer. Okay, and we will give it at a stage cycle so that we are killing the life stage. So usually the dewormer will work with the worms which are in the stomach.
Yeah.
Those worms will die. Some of the dewormers may have one of the compounds which may work against one of the life stage which is in the liver also. Okay, depending on that. So suppose I say there's a hookworm or a roundworm. Then I may give the dewormer every 14 days, depending on the life cycle of the worm, to be able to kill the worm at a particular life stage.
Okay.
So it depends upon not only what age the puppy is, we also depend on what we are deworming against. Depend on that. So it's a scientific thing. And generally, yes, the first time before vaccination we deworm, because we want the puppy to be having healthy, to be able to receive the vaccine and to produce immunity. If the puppy is not having good enough health, if it's deficient in vitamins, it will not be able to provide immunity. And if it has worms, it will be deficient in vitamins.
Yeah.
So they always deworm before vaccination to make sure it is a good playing field for the vaccination to take place. And in India, there was a study done actually. Earlier, though, they used to keep saying it is a thing from abroad. All the British and all of these people, whatever they say, we used to follow. So every 3 months used to be this cycle for deworming. It was taught to us in college. There was a study conducted for the tropical countries.
Okay.
Okay, that's called tropical, research, for which they found out that in our country, tropical countries, it is good amount of temperature, humidity, and it's a very good environment for things to grow. Right? India is the only country that has got 3 seasons when we can grow vegetables, and that's the thing. That's just very fertile. Our temperature, humidity, water is the best. Same way, worms can also grow. So they have recommended TROCAP, it's called. It's a tropical prevention. I think it's TROCAP is the name of the society that they have done. This lady is from Australia. She's done a lot of study in India. Okay. Australia has also got tropical areas.
Tropical areas, yeah.
So they have studied that for tropical countries, every month deworming is needed. Every month you do it because the worms are always exposed. They can get it from their feet, from the food, and there will be plenty, especially the animals which are there on the street. This every month dewormer is a good thing to do.
So, doctor, what are the common signs that pet is looking anxious or aggressive?
Yeah, so see, puppies, when we're talking about puppies, usually there won't be no much of anxiety, but they have the separation anxiety.
Yeah.
When we leave them go away, they'll keep crying and barking and all that.
Yes.
They'll be panting, or they'll be running around looking, eyes open. This sort of thing that is there. Sometimes they may pee and poop. They may get on to places where they should not be peeing and pooping, and they do all of those things. Those are all signs of either attention seeking or anxiety. So we have to question, then build down and have the questionnaire. We have a questionnaire where we see whether it is actually anxiety, or is it a separation anxiety, or is it all of these other, or aggression or dominance behavior. All of these behavior science is a different thing altogether. But generally, abnormal from the normal behavior, you can make out, and usually it is like this. They're running around, they're anxiety, anxious, how their eyes will be open, their behavior, they're shivering, they're going to corners.
Yes,
okay?
yes.
They may bark, they may not allow you to come in. These are all the, signs.
So how can pet parents help their new pet adjust to the new environments?
So very importantly, what to do, and another important thing is if you're having another pet in the house. Many people bring in a second pet. They don't know what is to be done at that time. So I tell people, they try to protect the two puppies pet together. They feel that this dog will bite the older dog will bite the younger one, or the older cat will bite. Cats are different; they will bite.
Yes.
But dogs, they will not bite. That's something people don't know. So cats, you must introduce them slowly. Dogs, you don't have to introduce them slowly. Dogs, you let them be.
Yeah.
Because their dogs know they will have the small, they will never harm each other, bite each other, harm to the fact that they will get harmed. So I tell them, let them deal with the politics. It's like, having a child who has gone into a new classroom. There'll be those bullies. Parent will not intervene, na? The bully will drag the new child in. The new child will submit, okay, say your boss. Once they establish these ground rules, they're okay. You should not interfere in that thing. So I would say, depending on what species your pet is, of course, that you have to ask us. And like for example, cats, you have to introduce them in a different manner. Birds, you have to introduce them differently. So this way, what you should do is, we will tell you, you make an even playing ground field for everybody. Bring them together as long as they're both vaccinated and defeated, detected, everything, and let them be together, and then have their own, taste. But what you also should do, like for puppies and pets, is pet proofing is important.
Pet proofing.
Yes. People, they go and grab the dustbin, they'll eat up from the dustbin, they'll
Yes,
chew the
yes.
wires. Okay, these are all accidents. They can go and eat tablets. Okay, so these are the things that can happen. They may eat things that have fallen in the kitchen ground.
Yes.
That there may be things which are toxic to them, like raisins, they can be onion, they can be things. So pet proofing is important measure when you're bringing your pet home. That is an important thing. Try to keep all your cables up so that they're not chewing things. The dustbins should be added to the wall so that they cannot push it down.
Push it down and
They should be strapped to the wall so that you can take it out and do it. Otherwise, many dogs can open the dustbin if then eat it. You can put it if they're bigger dogs, have put it in a height so that they cannot open it. Okay, and don't leave medicines and things like that outside which they can grab and eat from there. Also food, which are there, cakes and stuff like that, you just don't leave them around. You keep them inside because dogs can suddenly eat up the entire mithai dabba. I get this a lot.
yeah. So I have observed a lot that many dogs have eating paste.
Yeah, yesterday I had a case.
Yeah.
This lady has a lovely chocolate cake that was made with full chocolate.
Okay.
As she has kept it on the top elsewhere, thinking her pet cannot climb. It has climbed up and eaten it.
Oh.
So it has climbed onto the chair, onto the table and eaten it.
Oh.
So you must be able to assess that part. Vomiting and all, and check it for chocolate poisoning yesterday.
Oh.
So the things it should not eat, it will keep doing.
Yes.
So you have to think twice about that.
Okay.
A bottle caps, we throw it. He'll eat it and it'll get stuck. Mango seed. These sort of things, the dustbin is a really important thing for you to, secure.
Okay. So, doctor, the sweet thing, that is good for dog or how it is?
Sweets are not good actually in the sense for anybody for that matter, but it is not really that harmful. Dogs are not supposed to know how to taste the taste of sweet, but I totally doubt it.
Yeah,
they know. They do taste it, I feel. They can taste it, I feel. The research says they are not supposed to be able to taste it, especially cats, but somehow they do. Maybe it's a fat in the sweet or whatever it is. But too much of anything is bad.
Yes.
A small little bit of it is not a problem.
Yeah. So, doctor, I have a question. So, many pet parents, they are related to this. Like, most of the pets or puppies, sometimes we used to have few things on the floor, right? So, they used to chew them, or they plastics or something, rubbers. So, what it...
Yeah, so they basically, first of all, they like to chew. Okay, we have to provide them things that they can chew, which is not less harmful for them. At the same time, they like to play also.
Okay.
We are not playing with them.
Yes.
Unless they go and cook something that we want, they'll go and pick it, then we play with them, we get their attention. And they also like the sound of the noise of that thing,
Okay.
say a plastic noise, they like that. So they love to play and chew with those sort of things. So you should be able to give them safe toys. The things on the floor should not be, which are unsafe, you should take it off.
Okay.
Things that are there which are safe and which you can actually monitor. Say for example, I have a beagle also among my Indie dog and 2 golden retrievers.
Okay.
That beagle is a big destroyer.
Okay.
He will not play with his toys, but he'll want to destroy everything else. So wantedly, I give them say one, pet bottle, that is, the Coca-Cola bottle or something like that. I take the cap off because he can swallow it. He likes that noise. He makes a big thing. He throws it all over the place and crunch it and plays with it. Then it's done. I throw it off into the dustbin. He also doesn't want to play with it anymore.
Okay.
So he's done with it. And we have to give them the attention.
Yes.
When they're playing, you chase them, you play with them. It's a safe play and they're enjoying it.
Yeah.
But them, irresponsibly leaving things on the floor is our irresponsibility. It's not their fault.
Yes.
They want to play and chew and they can get into a very, very bad situation. So we should have a controlled thing of what we're giving them.
Okay.
Yeah.
So, like, they used to love that sound.
Yes,
What
they
are
all
the
love
things?
it. Yeah, love it. How do you like chips, right?
Yes.
It's a known thing. Everyone likes crunch. So they also like the same thing.
Okay. Yeah, got it.
So the thing is, on the street also, I tell people to muzzle the dogs and go, because otherwise they can just pick up stuff on the street. Mud as such is not a problem, but many times deficiencies can be an issue, or they can be bad habit.
Yeah. Sometimes dog will chew this grass on the
Street. Grass is okay. Grass is a normal thing. All animals, and especially during the monsoon, they eat it, they vomit.
Okay.
So that they want to induce the vomiting.
Okay.
But sometimes it becomes too much. So a little bit it's fine. They will eat it and then they'll vomit. and that's normal for them. They do it. It's a normal, I would say, wild animal behavior. That's what they do in the wild. Cats also, they like to have grass.
Yes.
Cats also, you should give grass. Okay, that they need that fiber inside. But when sometimes dogs are and they're sick, they'll go and eat a lot of grass.
Yeah.
That's a sign of something going wrong with the tummy. You should bring it to a vet.
Okay. So I have observed puppies. There might be few insects on there for like what the reason behind it in on cats as well as puppies as well.
Yeah. So that is ectoparasite, as I said. Lice, fleas, flies.
Yeah, lice.
Yeah, fleas and ticks are very, and lice also you get. Cat, dogs also get lice. Louse, they call it. Those are all like us. We also get ticks and fleas, and like lice, we get bitten by mosquitoes. So we have to prevent that from happening. See, it is a parasite will go to a host and eat it if it's there. So especially if an animal is sick, also this can happen. So what we need to do is prevent it by spot-ons, by tick collars, and by giving lot of now fluoroliners have come in to prevent the ticks also. But it's mostly a hygiene issue.
Yes.
Yes. So you have to keep them clean and prevent the ticks from biting them.
Yeah. While removing also, there's a very sticky to that hair.
Yeah, that's how
whatever.
they.
Yeah, we can't remove that.
Correct. It's dangerous also to do it.
Yes, yes.
It's a particular way to do it.
Yeah.
Otherwise, the head parts remain inside the body.
Okay.
Yeah.
So a few of the puppies or pets, like cats or dogs, whoever it is, they eat this poop.
Yeah.
Like what it is exactly, why they are eating that, and what suggestions you will give to the pet parents.
Correct. So it depends on whose poop they're eating. Actually, to tell you the truth, dogs are scavengers. Okay, that people don't want to accept it, but it's the truth. Dogs are scavengers, and there's nothing wrong with it because one's waste is someone else's food. Okay, and so many times dogs eat dung, cow dung. They do eat other dogs' poop. They eat even human dung, human poop also. We find it dirty, but it is a scavenging aspect. Okay, now the thing is, them eating poop can be habitual, can be natural also. Okay, in fact, and I'll tell you about this right now, gut dysbiosis and poop transplant, that's a totally different thing.
Yes, yes.
It's a natural thing also to settle the gut, and it can be habitual also. See, for example, they are in a place where they're confined. They don't want to dirty that place. They want to go out and poop, but they don't have no place to do it. They're confined there. They eat poop. They cannot control the poop.
Yes.
And then they feel guilty and they eat it up. That also happens.
Yes, yes,
and then
sometimes.
it becomes a cycle. So it can be a behavioral issue or it can be a totally natural issue. But this corpophagia is a very big issue and it's really difficult to solve actually.
Okay.
Sometimes you can only solve it by taking off the poop and throwing it and not allowing it access.
Yes.
And the second thing is to rectify the deficiencies it may be having. Many times they eat poop because they are deficient in certain vitamins, minerals and gut bacteria.
So the dogs will get habituated like that, or else we can just train them.
Yeah, we have to train them.
Train them.
Yes.
Okay.
And there are certain medicines that you can give, which will make the poop smell so bad that they will not eat it.
Yes, yes.
So those are available for us.
Okay, okay.
Yes.
So, doctor, like how important is establishing a daily routine for feeding, walking, playtime, and sleep?
Yeah. So that's very important, as I said. Setting of routines and timelines are really important for both of us to have a good quality of life and good understanding psychologically. So in the beginning, you cannot take a puppy out before 3 to 4 months of age after vaccinations are done outside the house.
Yes.
But you need to signal it whenever it has to go out to do its jobs. Sleep and food training is the most difficult thing for anybody. They get tired of it. So you should understand, you should make it understand a way that it can communicate to you that he wants to pee or poop. Okay, many of them are playing around so much energetic, they'll just go pee and go. It's like children.
Yes.
But you have to use the particular wipes and I'll tell you how to keep your house clean from these issues also. But the thing is, in the beginning, depending on the puppy, it may be 4 times a day of feeding. Okay, 4 times will be divided foods until it's about 4 months of age.
Yes.
After that, it becomes 3 times, and then afterwards it becomes twice or even once. And water should be available at all times naturally, and that's the thing. So every day in the morning, suppose you should get a puppy establish certain ground rules. Like say, for example, brushing of the teeth and cleaning of the ears, giving a brush, okay, and then giving the medication and drops and other things that it would need, and then you give the food. Then it would normally see, you will know when the puppy poops or pees.
Yes, yes.
Take it to a particular place where you assigned it, a place for it to go with jobs, and if it goes with jobs, praise it, and then they will play and then they sleep. So puppy routines, you'll understand that these are the activities: giving medication, giving and grooming, giving food, doing its jobs, and then play and sleep. These are the routines that will be repeated 3 to 4 times a day, and you will understand about the puppy's routines generally. So general thing which I said is feeding 4 times a day. General thing that I said is medication routine.
Yeah.
Poop, pee, sleep, and play. These things the puppy will set for you depending on each body condition. And then you set up the routine accordingly. Never play with a puppy with a full stomach. Okay. Its gas will form like babies.
Yes, yes.
Usually after they eat, poop, eat, sleep. That's important. Okay. And after it's 4 months later only, we will tell you how to take it out for a walk and all that, because they will get exposed to diseases otherwise.
Yes, yes.
So this is an important thing to set. It will take at least 2 to 3 weeks for you to set that routine.
Yeah.
Okay.
So when should a pet would have that first veterinary test after coming?
Yeah. So as I said, it should be 3 days, at least 3 days after they have come home. First visit should be there. Usually first visit is more of a veterinarian, it's more of a counseling rather than medicating. Depends also on what age the puppies come from. And also depends upon what all we find. We may do a full general checkup. Teach certain things like how to give medication, what are the things that are particularly that particular breed requires, or particularly that animal, depending on the pet, depending upon its anatomy, it may require. For example, Shih Tzus and all, they have eye diseases, right? So we will tell you how to look at and how to groom the thing. Poodles, which have become so this thing, how to establish the grooming routines. These are the things that we will be giving breed specific or individual specific advice as well as general advice. And also we'll be checking for fleas, ticks, what about the vaccination routines, and then we establish the veterinary visits.
Yeah.
So be prepared to visit the veterinarian. So these veterinary visits in the beginning is good for everybody. It establishes trust in your veterinarian and a routine, and you going to a place in emergency, you will know the routine. So you will not be scared, I have to go to a hospital.
Yes.
Pet also gets less anxious coming to the hospital. You also get less anxious and more comfortable coming and to the hospital. And then I would advise that every 15 days you visit the clinic for all of these things.
Yes.
Because the pet is growing, and then this, especially I would say this for cat owners and exotic pet owners, they are very reluctant to come to hospital.
Yeah.
And their anxiety levels are a lot more. And unless the pet is very sick and they're pushed to come to the hospital, till then they will not come. Reducing the anxiety to coming to the hospital, don't feed your pup before they come to the hospital because they vomit.
Yes.
They have car sickness.
Yeah.
So try to keep them in the car in a lower area so that, like us. I also carry something familiar, cloth or so that smells of home or its favorite toy. Always cover, if it's an exotic pet or a cat, cover the cage so that it's not seeing those visuals and getting anxious when they come in.
Yes.
So these are things that you can reduce as a anxiety of the visit to the vet.
Okay.
Yeah. So habit makes us more, I would say, confident of vet visits, and less stressful. So that's important for you.
Okay. So, are there any warning signs that require immediate veterinary attention?
Yeah. So the thing is, I would say the main warning sign is not wanting to eat. That's one thing. So usually what happens, people think that they're bored of something. Dogs don't really get bored. Okay. So first thing that they will show is not wanting to eat. Many times then we offer something else. Idi kaadu, we give something else. That's a very wrong step because of two things. One is you're missing the flag. See, everyone has got temptation. They kakurtupadi tintai. They will eat it, right? But the thing is, uh, so if you tempt it to eat, even though it doesn't want to eat, it will eat. Second thing is you are missing the sign it's giving you that he is unwell. So when they are not willing to eat food, that's something that you need to understand. Second thing is dullness, not wanting to get up and reactive. Okay, those are, you will
Yes.
understand immediately, you know that is a thing. But the first warning sign is not wanting to eat.
Okay. So when should socialization and this basic training begins?
Yeah. So basic training begins from the time that the puppy is brought home only.
Okay.
So training doesn't mean, see, it's like, how babies are there. Babies,
Yes.
they will not be sent to school immediately, right? But still we'll be teaching something there.
Hmm.
And we'll be reacting to what they say and we'll understand, okay, this means this.
Yes.
Okay. Also, we also have the other thing that we have a secondary thing like, to their noises, we will react.
Yes. Yes.
For example, when I'm talking about puppy training, puppy poop and potty training, okay, they may be barking or whining for something else. But every time he whines, you would signal and take it to the poop corner or the pee corner, saying that, okay, so he'll associate, acha, if I whine, then they're taking me there. So it is a reverse thing. So because, you are saying something, you say no, and then you are not giving it something, then he'll understand that no means no, he is not getting it, right? So that is the basic thing that you start training in the beginning only. What is the right place for it to say? As I said, you have to establish the ground rules. This is the place for you to sleep. No, in coming into some areas of the house, some people don't want them coming into the kitchen.
Yes.
So we say no, don't come in. Okay, and then they come in, we take it back and put it back and say no, sit down. And if it doesn't come in, you say reward it, right? So then you, with your no action, your word and your action, it is thinking, okay, I should not do this. And the other thing, reverse, as I told you, is about pee training. It is crying maybe for something else.
Yes.
But you are misunderstanding it or understanding it like he wants to pee. You take him and take him there, and so he'll think, okay, if I cry, they'll do this for me. So that is the basic beginning of training. That, and afterwards, socialization has to happen only after 4.5 months of age when the vaccinations are completed. Okay. And in the beginning, of course, if there are puppies and dogs in the home, then only socialization has started already, along with the people as well as the other animals. But definitely outside animals which are there and taking them out for a walk will be only after 4.5 months because the vaccinations will get completed.
So what simple training exercises should every pet parent starts with?
Yeah. So first thing, this I want to tell along with training is be very careful when you're putting the collar and chain. Many times what I do, people, so they think training means, also a restricting them. So collar and chain, be very careful. People used to tie up their pet and go away somewhere.
Yes, yes.
Many times they can get choked. I have seen many times they will be tying it to the steps, the ladder. Some people going upstairs, that railing will be there, they tie it up. I have seen dogs climbing up the stairs and hanging from there, and they have gotten choked. Many times I have seen them running round and round, and that entire leash is getting twisted around their legs. So if you have to, first of all, don't leash and put a collar. Put a collar just as it is. Don't leash it without your being present. Okay. If you are leashing it, it should be at a particular way. In the sense, it should not be like a punishment. Don't make anything that you want to do as a reward later. Say walking is going to be a reward for it, and for which will come a leash and collar. But if you are going to do leash and collar to tie it up as a punishment, then he will associate it with that one. So leashing should be done only in your presence because it will get frantic until he knows, okay, this is a good thing. Every day at a particular time you have to make that routine, as I said. Okay, this is the time you eat, this is the time you go to bed, and this is the time you are going to be restricted in this area, and it should not be ever a punishment. Okay, especially when people sometimes, suppose it's a large breed dog, or there are some people who don't like dogs, and those people are coming to do your work in the house every day. This maid will come, so you feel that you don't want your pet to interact with the maid for some reason or the other. So at that time, what you should do? Okay, maid comes at 8 o'clock. 7:45, you will restrict this puppy into its own enclosure, giving it its treats and stuff like that, so that it's entertained. So it becomes a routine. Okay, 7:30, 7:45, I'm going there. It's not a punishment.
Yes, exactly.
Okay. So So that should be your routine that you make. These are all the training patterns. This is how you make a routine actually. And one thing your puppy should know, and these are the most difficult things, is no, and then not allowing it to bark when you don't want to. That's another very difficult training to do. Sit, okay, and not begging at the table. You don't encourage the begging at the table because people will tend to give it, and then all kinds of there is upsets problem. And some guests may not even want dogs begging at the table. It's embarrassing at sometimes, right? And later on, leash walking, trotting, that is walking along with you, not pulling you. Because if it's a big dog, you can get a shoulder thing. If it's a smaller dog and running, it can get choked because you're pulling it. So leash walking and heel walking, as we call it, or trotting. These are the things that are good for you to teach when they're much older. And a very, very useful exercise is to fetch. It's a fetching exercise. When they are older, because see, no, you cannot outrun your dog ever. They're built, they're athletes. They don't have that amount of strength. So, and yet if they have so much energy, they do not use that energy, they're going to get destructive. So you need to be able to play with them. Okay, you need to play with them, interactively play. Plus you need to give them good exercise. Okay. How do you give exercise? The best way to do it is throw a ball. So it is going and fetching it and bringing it back. In that way, what is happening, even the brain is getting exercise. It's going to look and see where it is there and going and fetching it, bring it back. So running up and down will, increase the metabolic rate, and it's a good way of exercising. Otherwise, you are not going to be able to run along with it. It's really very difficult for most population to run along with that vet.
Yeah.
So fetching is a very good exercise that, later on it's very useful for you to keep a dog exercise in a small area. To this thing. These are good things, commands that you should, aim to teach your dog.
Okay.
Yeah.
So, how can pet parents prevent separation anxiety from developing?
So again, it is routine making. So usually, what happens if you go out? Suppose you're going out to office every day,
Yes.
right? So you go out even on Sunday, Saturday. You should do the same thing. Pretend to go out because see, it cannot know it is today Sunday, today is Saturday. So I'm going to be home. What happened on Monday, right? So you prepare to go out at a particular time and come back, whatever it is. Maybe you will have to go for shopping. So you go on the same time that you go for office at work. So it becomes a routine. You come back. He will not know that you come back early. One thing he knows, you have gone. But they do not know that amount of time that you come back. That sense of timing, they're too young to understand that length of time. So when you come back and then we're giving it some treat or something, that if it's been a good thing, so they look forward for you to come back. They in fact look forward to go out because they know you're going to bring back something. Right? It's like with children only. Yeah. Children, when they go in the beginning, they're crying when the parents go to work. But when they come back, usually we parents, we try to bring back something. Mummy, Papa, kya leke aaya? That sort of a thing. Same thing, Mummy, Papa, kya leke aaya? Either it may be a treat or it may be saying, oh, chalo, ghar aa gaye, let us ghumne jayenge. We'll go out and play. We go out and walk. So these are in fact positive reinforcement. Grooming it, taking out for play, interacting with it. Everyone wants attention. And that's what you need to give as a reward. Okay. Yeah.
So what is the best way to introduce your pet to children?
So the thing is, see, it depends upon how old the pet is and how old the child is.
Okay.
Yeah. And also the size of your pet. See, many children like toy dogs. They look small dogs. They like them. But toy dogs and small dogs bite also. They are ferocious. People don't understand that. Larger dogs are less ferocious, but children get scared sometimes if they've never been or seen a pet before. So if it is a tiny dog, if it's a puppy of a large breed puppy, say for that matter, they are going to also grow fast, and the children may not be able to. They all want to carry the pet. One thing we used to warn people is, don't treat your pet like a toy. It's not a toy. Many times children don't know what to do that may hurt the puppy, and then will create this reaction of biting, because that's how the puppy will protect itself, and then this fear will happen. My dog has bitten. That innate fear is there in everybody. Dog has bitten, something is going to go wrong. So that's the thing. So we must teach our children what is, I would say, like how we teach good touch, bad touch to children. Same thing, good touch, bad touch for dogs. Right? It's very important that, they don't like certain things to do and they will react. So like for example, pull tight, how to hold a puppy comfortably, by securing it Okay, they cannot just hold it like that. They cannot carry it that way. Okay. Secondly, the puppy may be too heavy for the children to carry also. So carrying and keeping of the puppy should not be allowed. Okay, many times I've seen them, they will carry the puppy, leave it on a table, dining table, and go out and play. Because children have short exam, the puppy does not know it's on the table. It's walked off and fallen off and fractured itself. So definitely carrying should not be allowed unless the children are a little bit older and they understand the meaning of it, and then they are taking responsibility of carrying it and taking it to the clinic or bringing it to bring the children along with the puppy to the clinic, because they understand the medical needs. Children are very wise nowadays. I mean, they've got the level of I would say awareness has improved so much, and the level of using information in the right way also is improved. And therefore introduce your children to the not like a toy but as a responsibility. And in every age is okay. Even as a baby, in fact, my my babies were introduced to adult dogs, puppies, when they were just a couple of months old, because if children have a way with animals,
Yes, yes.
all we need to do is teach them what the animal does not like. Okay, there may be things that, and like pulling off the tail or dragging it or things like that, which may be uncomfortable to the pet. You should teach those that that can be painful, like the same way it can be painful for you. And the way you will react is you may cry and complain to your teacher or complain to us, the parents. But how the puppy will react, it will cry and try to bite you and take off that bad stimulation. And that becomes a very, I would say, unpleasant experience for people. So that is what you need to do.
So, what is the few skills that pet parents should learn?
Yeah. So see, puppies and see, medicines and disease. Disease is a permanent thing. Anyone which is alive is going to fall sick, right? So you must be prepared for two things. One is preventative and hygiene, and giving of medication. Okay. So we teach people when they come in only, puppies when they come, pet parents, we empower the pet parents with two things. One is how to give tablets to the pet. Open the mouth and push it right in. Okay, and in fact that I'll show you as a demonstration how to give pills, and you should start this early. Okay, so because people try to mix the tablets in the food, and it is distasteful. You will not like one crochet in your food. You will not eat it, right? Why will the pet eat it? But we swallow it. Similarly, we show how that pets can swallow a tablet. We'll teach you how you have to learn how to give tablets, give syrups. Okay, in the beginning we just give vitamins so that it's a practice for you and practice for the pet. And the other thing, skill set that a pet parent should know is how to brush their teeth. See, like we have a preventative hygiene. Oral hygiene is very important. And in fact, if you don't have a good oral hygiene for pets, it can reduce the lifespan by 2 years.
Okay.
Okay, because of bad oral hygiene, because they cannot chew. And it can also result in heart disease. It can result in kidney disease because the bacteria are going in the mouth. So you are going to be brushing the teeth every day. Your teeth you brush. You have to brush your pet's teeth also. People say, okay, I'm giving chew stick. Is that not enough? I would say, if you're chewing gum, are you not going to brush your teeth? Right? Chew stick is a different thing. Brushing is a different thing. Nothing can replace brushing. Okay. The third skill I teach pet parents is how to take temperatures. Because for human beings, we take the temperature in the mouth. Okay, we may take it in the armpit. You can't take for pets also in the armpit, but you have to adjust the temperature. And it's not very accurate. The best way to take it is in the rectal temperature. And people are very reluctant. First of all, they don't even know where the rectum is or anatomy wise, and whether it's painful or not. So we teach, and also most of the animals, their temperature is more than us. It is say for example, normal temperature for a dog is about 101.8 to 102, say for example. That means it's like fever for us.
Yes.
101 and 102 is fever, right? So when we feel the pet, array, it's hot, we feel. But is it fever or not? Better to check before you can react properly. Like how we would check a baby's temperature, right? We would tell them and see. There's a few skill sets that pet parents should know as a first aid. Okay, to be able to inform to the doctor so that they can take appropriate action. So these are to be started really early. So for nothing at all, they learn to take a temperature every day, to learn to give medication, and definitely every day brush the pet's teeth. Okay, yeah.
Yeah. Is it okay to let a new pet roam freely around the house on the first day?
No, actually, it's a never do that because the pet doesn't know it's a new place, right? And it can get into places which can be dangerous for them. So, and first of all, the pet also will not roam freely because it's scared. It'll be only in one place. They may roam around in one area, and they may start following one person. Okay, and then they may follow, but you keep doing, seeing whether the pet is following you or not, because sometimes there may be steps, the pet may be climbing behind you, and they may fall off the step also. So important that you restrict it into areas which are safe. There may be sometimes, in some in one person's house, there were little bit, there were actually a fish pond inside the house, koi pond was there, and so the one day they were searching for the pet and they found it in the koi pond. So they did the pet, that was the puppy in the house, did not even know.
Yes.
So it is on the floor level. So these things can happen. There are areas which are dangerous for them. And so it is not advisable unless the pet is big enough, old enough so you need to puppy proof and pet proof your home against all the dangerous areas, like how you do for a baby who's crawling around. Okay, similarly, you should puppy proof and pet proof and only then allow it to roam around everywhere.
Okay.
Yeah.
So one must-have item for every new pet parent.
Yeah, one must have is, I would say, I would add a couple of must haves also. Is of course everyone should have their separate bowl, water bowl, and feeding bowl, and a nice bed to sleep in. These are very important, and of course, I would say a bit of cotton and dressing material, like cotton and little bit of say liquid paraffin, to clean up the eyes and the ears, and a nice brush to comb the hair. These are important for its, for comfort levels. That's a must-have thing, other than the regular food and water, everything. And I will say one more thing is you should have the emergency number of the veterinarian written on your fridge, so that you can not running around for it.
Yeah.
In fact, that's what we're going to be providing, a nice fridge magnet, so that you can put it on the fridge, so that immediately you want, you can just look at the numbers and call.
Yeah. So one habit that every pet parent should avoid.
So pet parent should avoid indulging a pet, in the sense, whatever the pet wants to be giving it, whatever it wants, so that how we spoil the children similarly. If it wants something, you give it. That should not be the way. That word no should very important. Being strict is important. So what is not okay when it's a puppy, not okay when it becomes an adult, it cannot be okay when it's a puppy. For example, when we're walking, normally they like to play chase. They like to be behind you and try to bite you or pull you or starry or any of those things. Many people, of course, many people find it threatening and also discomforting, and they might want to chew you also, right?
Yes.
So people are allowed to be chewed, right? When they are older, it will not be allowed, right? So just saying no and making those boundaries are very important. So one thing that you should have skill set is to say no.
Okay. So what's one piece of advice you wish every new pet knew before bringing a pet home?
The advice I would tell is every pet, has a lifespan, will grow up. It's a lifelong commitment, but it's a commitment of joy. The amount of joy that they will give, same amount of sadness also they can give you. And this is something that we must be prepared for. And also the fact that they can fall sick like us. They have all the diseases like we do, right from hygiene, from simple surgeries to medical issues to hospitalizations to spinal surgeries. And pets are like pediatric. There is small size patients in a geriatric. They become older very fast. They get old age issues very fast. So medicines, treatment, it's a lifelong commitment. Your kids will grow up and become independent. But your pet is never going to be independent. It's going to be always dependent on you to provide you health and care and emotional support also. So that is something that every pet parent should know. It's a commitment of joy. I would say emotional commitment there. And we have to be prepared for these, expenses that may come. And insurance is a very good way to do that. Getting a pet insurance, getting a wellness package in a clinic, getting an insurance so that it overcomes all of these things in the beginning itself. It's a safety net, for all pet parents, because those accidents are there for every life to happen, and we would like that that they are able to afford to have good treatment for the pet.
So, if you could leave our audience with one message about the first 30 days with a new pet, what would it be?
I would say observe and react, okay, but don't panic, okay.
Okay.
And every time there's something there, find out more. It's more about information that you know and the skills that you're learning. It's the first 30 days is like you're gaining your skill sets and making the you're setting the program for the next 15 years. So this 1 month is really important, as an interaction and the building of a bond as well as building of a relationship that is going to be showing you for the next 15 years. And there's a lot of learning that goes on there. So it more than treatment, it's learning, and be prepared for the joy.
Where can pet parents find reliable information to continue learning about responsible pet care?
So I would say reliable information is the key, right? Because there's so much that goes on the internet. Okay, so always cross check to see the background of the person who's talking. It's everything is there on the online nowadays. See who's talking, what kind of credentials they have, technical credentials they have to say what they're saying, and there's lots of it on the internet. But of course, always cross check with a vet. They come by and say, okay, this is what I've heard. Is this good? And cross check with the vet, because your vet who's your family doctor. It's really a family.
So, before we wrap up, could you please give our listeners that next episode of our
Plan to take you through the entire journey of pet parenting and the various skills. There will be short videos of how to brush your dog's teeth, how to give medication, how to take temperature, how to do the brushing and ear cleaning, all of those. Also, simple first aid, how to take care of wounds, and there will be episodes on different diseases and how to prevent them. Okay, so there's lots coming up, and we'd also like to hear from you what you would like to know, particularly. So we would like to, we can talk more about that. So, friends, I hope this episode was interesting for you. We'd love to hear more comments from you. Our next episode would be about vaccinations, its myths and realities, and the different types of vaccinations, and how to make sure your pet stays protected against various diseases.
Yeah, doctor, thank you so much for your valuable time. So I hope that our listeners have learned a lot of things during this session. We look forward to have you on the other episode. So if you guys are having any questions or any doubts regarding this session, you can just comment us so that we will cover all the topics on the next episode. Thank you.